We know that there are currently around 190 patients in this hospital who will need to be moved as a result of this discovery, either to a different part of the hospital, another hospital entirely. Some can be discharged and others may even be moved into care homes, and work is already underway here. When we arrived earlier, workers were up taking pictures of the roofs, bringing scaffolding in. Now, what we know is that it is the main building that is most affected. That is where most of the wards are, and that part of the hospital is more than 40 years old. And what we have been told is that the tiles have reached the end of their lifespan, and that has been meant that water has been coming in, which over time has caused the wooden battens which support the roof to rot and in some cases disintegrate completely. Now, that is going to sound incredibly worrying to some people, but we have been assured by the Health Board tonight that patients and staff are not in danger, and the decision to move patients is merely a precautionary one. But for the Health Board to declare a critical incident is not something to be taken lightly. And earlier I asked the Chief Executive how it's been allowed to get to this point.
We've maintained this site significantly. Clondalkin Morgannwg took on the Bridgend locality in 2019, and obviously this site was part of that. Since then, we spent £19 million on the infrastructure at the Princess of Wales site, including roof works as well. But obviously, this particular challenge was hidden under the tiles, and until we've had cause to lift the tiles, we've not really been able to establish the extent of the particular damage that we're experiencing.
And Katie, have we any idea how long these problems might take to fix?
Well, the Health Board estimates it's going to take several months, because we're not just talking about a few repairs here and there. We're talking about an entire refurbishment of the roof, and a big job like that comes with a big price tag. The Health Board thinks this is going to cost into the millions of pounds, so it is currently in talks with the Welsh Government about how they're going to fund that, and this couldn't come at a worse time for the hospital. We're about to enter the winter months when, as we know, hospitals across Wales are at their busiest, so this is going to mean significant disruption over the next few weeks and months. Patients are being advised to turn up to their appointments as normal unless told otherwise, and they're also being asked not to come to the emergency department unless their condition is critical or life-threatening, to help ease what is now going to be even more pressure on an already busy hospital.
OK, Katie Fenton in Bridgend, thanks very much indeed.